Hello and welcome to KPLE. Today we have a special program of Central County Services Health Awareness. More hope, more recovery. And in the studio with me, we have Dr. Cheryl Paulus, who's the Director of Behavior Health, and we have Mr. Vincent Hochstadter. Hello guys and welcome to the show.
Thank you for having us today.
Thank you all for being on the show. Let's start with you, Dr. Paulus. Tell us a little bit about, we're talking about more hope, more recovery, and tell us a little bit about how do you envision the recovery in the community for community behavior health for adults and children?
Okay, great. Well, first of all, I think I want to orient you a little bit to community mental health.
Okay.
So in our center, we have a whole range of services for children and adults, and the scope of practice is very, very wide. We have psychiatrists and therapists, counseling, case management, we have consumer benefits, we have day programs, youth empowerment services. So we have an entire range of services to offer on an outpatient basis, as well as we have just introduced primary care. So we're looking not only at behavioral health, but we're looking at primary care involved in our menu of services.
Wow.
In terms of recovery, from my perspective as a behavioral health director and someone who's been in the field for the last 30 years working from the ground up, I really see recovery as deeply rooted in connections, deep interpersonal connections. And this makes a lot of sense if you think about the beginning of life. Our very psychological and physical survival is dependent on close interpersonal relationships. And this is important throughout our entire lives. And in addition to having close interpersonal connections, infused inside of that is all types of treatment. We have cognitive behavioral therapy, cognitive processing therapy. We look at the whole person and we aspire to what's called holistic and integrated care, which means we're very interested in the whole person, mind, brain, body, and spirit. And also, it's very important to understand the economic and social issues that impact people. So we know that this type of approach emerges out of a wide range of people working together.
That's good.
A wide range of practitioners, as well as the folks that we're serving, and the families, and people in the community, stakeholders.
Okay, and I want to come back to you about trauma-informed care, but I want to ask Mr. Vincent real quick, how can someone enroll in Central County Services?
For children, if a parent or a guardian is wanting to enroll their child in the services, they have a couple of options. The first option is going to be for them to utilize our walk-in clinic times. And so for Colleen, it's going to go ahead and be on Mondays at 8 a.m. In Temple, it's going to be on Tuesdays at 8 a.m.
Okay.
And then the second option would be to call our main center, our intake, and have them schedule an appointment for their child to receive the services.
And back to you, Dr. Paulus. I know working with behaviors and different things and in the foster care system like I do, this next term we're going to talk about, I hear it all the time now. Tell us a little bit about trauma-informed care.
Okay. So trauma-informed care is really a huge movement that started actually about 20 years ago, and it's just picking up steam and becoming a national initiative for all centers, schools, community mental health centers, hospitals, to become organizationally what they call trauma-informed care. And this means that essentially that people are very sensitive to the profound implications of what trauma, how it impacts people over their lifespan, and also essentially understanding how it impacts every aspect of development from birth through death. That trauma can impact anyone at any time. It can be a single event. It can be something that is a chronic issue. It can be a catastrophe in the community. It can take on many different forms. But really this trauma-informed care was inspired by a landmark study in the late 90s called Adverse Childhood Experiences. And this essentially was a groundbreaking study that people are talking about all over the world today that looked at various events that happened in people's lives, particularly before the age of 18, and how, as time went on, it had profound implications not only for their mental health, but for their physical health. And so essentially, it's really infusing into our care now the sensitivity, the education, the awareness, and the acknowledgement of how profound adverse childhood experiences are, and also what types of treatment are available for folks today. There's a very wide range of types of treatment, and one size does not fit all. There's much hope and optimism with this movement.
That's awesome. And I hate to keep jumping, but back to you, Mr. Vincent. What qualifies a child to receive services at Central County Services?
Well, first, they have to be brought to our services by their legal authorized representative, which would be either their parent or a legal guardian. And then secondly, they would have to qualify with a mental health diagnosis.
Okay.
And with that being either behavioral disturbance or an emotional disturbance. We utilize what's called the Child and Adolescent Needs and Strengths Assessment, which basically then places them into a service package, which kind of suggests what services they would best benefit from. And then the clinician providing on that assessment also has the authority to deviate that to a different package if they feel it would be better.
So if someone watching us today wanted to know what areas you have services in, tell us a little bit about where you guys are located.
Yeah, definitely. And so our catchment area is for Bell, Milam, Lampasas, Coryell, and Hamilton County.
That's a big area.
Yes, sir. And so we have an office in Temple, one in Killeen, one in Coppers Cove, one in Hamilton, and I think that is it.
And Dr. Paulus, do you bounce around to the different areas, or you just stay in one local spot?
I try to get around to all 5 counties. I do spend probably the majority of my time in the Temple Clinic, but I'm very much out in the community and working with folks. I've learned so much about the community and from folks about the subtle nuances of what this community needs, and we've really made a lot of gains in providing new things for folks, especially in the way of housing, supported employment, working with the courts, addressing issues around the high volume of folks that end up in emergency rooms, working mobile crisis outreach. So we've really expanded our services in the last few years.
A whole plethora.
It's really quite wide-ranging, yes.
I love it. More hope, more recovery. What would you say to the parent or adult or someone sitting on the couch watching us that's really thinking about, you know what, I've been through some trauma, I've been through some horrific stuff in my life. What would you say to that person to come and see you guys, or what would you say to them?
I would say you are absolutely not alone. This is something that just by way of being a human being, we know that the percentage of everyone is so high that people have had some type of adverse experience that impacts their ability to sort of feel whole or to do, to perform at the level that they want to, either as a parent, as a partner, as a friend, and that there are so many options for you. You're not alone, and this is something that will impact generations to come by you coming in today. The ability to make things better for your children, your grandchildren, it's a reality.
And we have about 3.5 minutes left. I know that's something I didn't ask that you guys may want to talk about in the next 3.5 minutes. Here's your chance to do so. Any final thoughts?
Yeah, I think there's children, parents of children are often looking or often wonder what would warrant a mental health assessment. And I think a lot of them are ambivalent on where, what these signs and symptoms are. And Just to name a few, for adolescents and children, you may want to pay attention to like their academic performance, any changes in their behavior, any episodes of isolation, or pay attention to what they're saying. If they say something along terms of bullying in school, or along terms of any thoughts of wanting to harm themselves or others, those are all key things to pick up on as a parent and would warrant come into Central Counties for an assessment.
Dr. Paulus.
Don't wait. If you're not sure, you can never hurt anyone by calling and asking if you think someone perhaps is in danger, that they're feeling suicidal, they're very depressed, you're not sure what to do about it. Don't be afraid to ask the person about how they feel. Don't be afraid to call us and get a consultation, even if you're thinking, gee, I'm not sure I want to make that step to come in, but there's always someone to talk to on the phone. We're here to help you, we're here to serve you. It's our mission. We believe in this very much, and we hope to hear from you.
All right. Well, I want to take this time to both of you, from us at KPLE and from many people in the community, just thanks for what y'all do. It may not seem like it sometimes, but it makes a difference. You know, Maya Angelou said, people forget what you say, people forget what you do, but they'll never forget how you make them feel. And I think when you make people feel invited and welcome when they come to you, it speaks volume for your services. And I've visited the center, and as a visitor, I feel welcome, so I know people feel welcome coming. So thanks for what you do, and thanks for being on the show. We really appreciate what y'all do.
Thank you very much for having us today.
Yes, ma'am.
Thank you.
Welcome back to our special programming, and in the studio with me we have two members from ECI. We have Miss Susan Peters, who's the ECI training coordinator, and we have Miss Diana Garcia, who's the ECI regional coordinator. Hello, ladies, and welcome to the show.
Hello, thank you for having us.
Well, we're about to talk about something that's near and dear to both of y'all hearts. Let's start with you, Susan. Tell us, what is ECI?
Well, ECI stands for Early Childhood Intervention,
Okay.
and ECI is actually the federal component to provide services to children from birth to 3 who have developmental delays or disabilities under the IDEA, which is Individuals with Disabilities Education Act. So ECI provides services from birth to 3, and then the public school actually picks up and works with those children from 3 to 21.
Okay.
And every state has an early childhood intervention program because of that federal component. And in Texas, the ECI programs are with host agencies, and our host agency is Central County Services. So we serve the 5 counties that they serve, which are Bell, Milam, Coryell, Hamilton, and Lampasas.
Wow.
And we provide those services in what's called the child's natural environment. So we go into the home or into daycares, or actually even out in the community if families are struggling with taking their child with special needs, like to the grocery store or out to eat or to the library. We'll go into those settings as well to help them figure out how to help their child be successful and how to help their family go out and do what other families would do out in the community if they had a child who was developing typically.
And speaking of children, how are children referred to ECI?
So anyone can make a referral to their local ECI program if they have concerns for a child's delays, or if they feel like a child may have developmental delays. And there is actually a law that says that professionals who work with children under the age of 3 who suspect or know that a child has a developmental delay should refer to their local ECI program because we are that federal component. Of course, families always have a choice about their services, but they need to know about us because one of the things that we do is provide what's called a full array of services.
That's awesome.
So we provide service coordination, or it's also known as case management, to families. So every family has a service coordinator who works with them to have oversight for their case and then help them access any additional resources that they might need to help their child develop successfully. And then we also provide physical therapy, occupational therapy, speech therapy, and then another service that's unique just to ECI is called specialized skills training. And that is provided by early intervention specialists who are credentialed in the state of Texas to go into the home or out into the daycares, the community, to work with the parents or caregivers to help their child meet their developmental goals or outcomes.
Y'all do a lot.
We do a lot.
Diana, how do children qualify for these services?
There are 3 ways that children qualify for our services. One is through developmental delay, the second is through a medical diagnosis, and the third is through a auditory or visual impairment.
Okay.
The developmental delay, the state has given us a test to use. It's called the Battelle Developmental Inventory Test. The test is a standardized test, but we go over all the areas of development. So that includes gross motor skills, fine motor skills, cognitive, communication, and self-help skills that the child needs. And so we do the Battelle to determine eligibility.
Wow. And what are the next steps for children to qualify for these services? And what I mean by next steps, just if parents, you know, been through certain services before, can they come to you guys for like since you deal with it more than some other places, can they come for you for like a final consult to see if the child really needs the services?
Yeah, I mean, definitely, like Susan said, we do take the referral, and we're more than willing to evaluate any child under the age of 3 to determine if there is something that we need to come and step in and help with the family. And yeah, so yeah, definitely they could come in for an evaluation.
And you said under the age of 3, so you provide the services from 0 to 3?
Yes, sir.
Okay. This question is for both of y'all. And of course, people always want to know how much does it cost the family for this, and you could take turns, or let's start with you, Diane.
Okay. We do have a family cost share in place that the state has given us, and so what we do is we take family size and income to determine what the possible cost would be. We also take insurance and Medicaid and just an array of insurances, and so that's all discussed at the beginning after or before the evaluation, or family can just call to see if what their possible cost could be.
Okay. Did you have anything to add to that?
The ECI is unique in that it's funded by many different components. So we receive federal funding, state funding, and then of course Central Counties does in-kind funding as well. And then the family cost sharing insurance are all ways that we are funded as a program.
And usually with people, and I forgot the last 2, but I can tell with you guys, what drives you to do this job?
Well, the love for children, first of all, and we've just realized that it's so important to, not only are we just providing therapy, but we're really helping the whole family to be able to work on those delays that the child's demonstrating. So we really want to be able to come in and help them to provide the therapy all the time, not just those few hours that we're there in the home. And so it's just so important that it's a full-based service.
That's good.
Yeah.
And
Anything
I think it's the same thing, is that, you know, we have this unique opportunity to come in and work with families at the beginning of their journey. And this may be a lifelong journey for some families, depending on the child's diagnosis or medical condition. And so we can come in and really help walk alongside them and help them learn skills to help their child be successful as they, you know, as they journey through whatever.
And say what comes to mind when I say these 4 words: more hope, more recovery. Go.
Definitely recovering after a new diagnosis, kind of helping the family walk along like Susan was talking about, and the hope that there's help through ECI to help them catch up in where they need to catch up in.
I agree, and I think it's hope for families to know that their child can make progress, their child can improve, and that they're not going through it alone. You know, that that's the other thing, is we'll sometimes help them locate support groups and other families that they can talk to and connect. We also do some group services where children can come in and have their services in a group setting, and then families have that opportunity to meet with other families and find out what it's, you know, share their experiences and talk to other families who may be going along those same.
And Susan, I'm so glad you say to let families know that they're not in it alone. Because so many times we live in a society where if something's going on with my family, well, we're the only ones going through this. And it's so much, brings so much joy for people to know that no, you're not in this alone.
It does.
Why is it so important for awareness? If a parent thinks that something's wrong with their child, why is it important for them to come seek your services?
Well, we're interventionists. We want to be able to start early and provide that therapy at an early age so that way we can make progress. And it really is very impactful at an early age.
It is. Studies have shown that birth to 3 is when the brain develops the most.
Yeah.
And so we can get in there and hopefully have that impact that Diana was speaking of and help families start negotiating those pathways early on.
And any final thoughts?
One of the things that we forgot to mention, we also help the family transition. Since we are an infant to 3, once they start getting closer to their 3rd birthday, we really help the families transition into other services, which could mean other services that the Central County Services provides, or the school district.
Okay. Any final thoughts?
Just that please call if you have any concerns for your child's development. We are there. It's open to anyone who has concerns if their child is under the age of 3 and lives in our catchment area.
And here locally, what all centers do you have? I know Belton.
Yes, we have an office in Belton.
Okay.
There is an office in Harker Heights, and
Okay.
we also have an office in Cove. It's a small office, but those are 3 locations where we provide the evaluations.
Okay. And Diane and Susan, I want to take this time, as I do always, thank you guys for what you do. It does make a difference. And again, I told the group before you it does, but it really does make a difference. And sometimes you feel, oh, am I doing anything? And you are. So just know that.
Thank you.
And thanks for being on the show.
Thank you.
Thank you for having us.
Yes. And we'll be back. Hello and welcome back. In the studio with me now we have Andrea Erskine and Miss Kristen Zychek. Andrea is the Director of Intellectual Developmental Delays, and Kristen is the Board Certified Behavior Analyst. Hello ladies and welcome to the studio.
Hi, thank you for having us.
Let's start with you, Andrea. What does IDD stand for?
So IDD stands for Intellectual and Developmental Disabilities. And it's an umbrella of various diagnoses that a person could have. And also under that umbrella, we provide several different services at Central Counties to meet the needs of individuals with intellectual and developmental disabilities.
All right. How long have you been working in the field?
This is all I've ever done since college.
Right.
I've been in the field for 13 years now, and have been at Central Counties for 12.
Okay. And what is an intellectual disability?
So the best way to describe it or to explain an intellectual disability is to think of an old terminology that is outdated and we don't use it anymore, mental retardation. So with an intellectual disability, there's really 3 components that we're looking for. We do IQ testing through a formal assessment. We do assessments to determine an individual's adaptive functioning. So how is that disability affecting their day-to-day lives? And then also the diagnosis has to be present prior to age 18.
Gotcha.
So.
And Kristen, on to you. What is developmental? What is a developmental disability, specifically the autism spectrum disorder?
Well, a developmental disability is a group of conditions or symptoms that are actually impairments in the areas of cognitive functioning, behavior, and some physical impairments. And some common developmental disabilities are Down syndrome, fetal alcohol syndrome, vision and hearing impairments, Down syndrome. But autism spectrum disorder is a common developmental disability, and it's characterized by impairments in 3 separate areas, and that's communication functioning, social skills, and behavior. And a lot of times these individuals have really restricted interest, or they display repetitive behaviors. A lot of these symptoms are visible prior to age of 2.
Okay.
And so the most important thing to remember about autism spectrum disorder is that it is an umbrella. It's a big spectrum. So an individual does not have to have an intellectual disability. They do not have to have a low IQ to have ASD. But there's a wide range of functioning. And so one of my favorite quotes is, if you know one person with autism, you've only met one person with autism.
Wow. If you have a family who's questioning and thinking, what would you say to that family about bringing a kid in and getting them tested? What would you say?
I would say go seek advice as soon as you can. The research shows early intervention is the best tool that families or individuals have when they're dealing with autism spectrum disorder.
And you kind of answered this question a little bit, but just expand on it a little more. Can individuals with IDD also have a mental illness?
They can. In our field, it's called dual diagnosis, and that's where individuals have symptoms or diagnoses of both developmental disabilities and mental illness. And a big association that's out right now, the Association for Persons with Developmental Disabilities and Mental Illness, estimate approximately 30 to 35% of individuals with developmental disabilities also have psychiatric disorders.
Wow. What can, this for you, Andrea, what can someone do if they suspect a loved one has anything?
So they can always call our intake department or just call the main center and get routed to the IDD department. And you know, we're right there with mental health, so all they need to do is let them know what they're calling for, and they'll get to the right place. Or you know, someone should talk to their physician. We get referrals from ECI because for a lot of the children that they serve, they have an intellectual disability or have autism, and so we would at times be the next step for them.
And how long have you been in the field? I asked Andrew, but forgot to ask you, Kristen.
Well, I've been a behavior analyst for 6 years, but I taught in public school while I was a behavior analyst, and so this is my 4th year at Central Counties doing just behavior analyst work.
And tell us a little bit about what all that entails.
Okay, well, we study applied behavior analysis, which is the science of targeting socially significant behavior for individuals, and we apply interventions. So we're trying to improve or increase appropriate behavior and potentially decreasing inappropriate behavior to help individuals be successful and be able to achieve what they want in life.
What are some challenges people face when they have these disabilities? Share some of those with us.
So the overall big picture, I feel the biggest challenge for individuals with disabilities is acquiring and maintaining a high quality of life. I think for all of us, we work to be happy, find purpose in life, to be contributors to society. Individuals with disabilities first need to be taught and supported to be advocates for what they want to do. And then they need specific skills taught to them so they can achieve what they want in life.
And speaking of specific skills, Andrea, can a person with some of these disorders, can they gain employment?
Absolutely. People with intellectual disabilities or autism or any developmental disability definitely can and should be employed in the community. There's kind of an old way of thinking that people with disabilities should just be in a sheltered workshop, often doing work that's at piecemeal rates, just putting very simple things together. And in reality, a lot of our individuals can work in various jobs, just how any of us have different interests and skills and things that we're really good at. So do people with disabilities. They may need a little bit more support in the beginning to learn their job and you know how to dress for an interview and how to make eye contact appropriately. But that's what we're here for, is to help develop those skills. And you know, employers shouldn't be afraid of hiring somebody with a disability. Often they'll find once they give that person a chance, the person with a disability may end up being one of their best workers because it gives them a purpose, they take pride in their work, and both parties really benefit and can gain from the experience.
Kristen, why is it important for schools to include people with disabilities into programs or different things they're doing at the school, in the community?
I think when we're thinking about school and community, it's important to remember individuals with disabilities are first just individuals. We have kids or family members that are in school or in community, and it's important for us that they are that they have access to everything that everybody else has access to. And it's important that they start learning what they like, what they don't like, what they're interested in. And I also think that individuals with disabilities sometimes might have behavioral issues or anger management issues or challenges that everybody can see. However, it's important to remember if they're out with access to school activities, to community events, church activities, that a lot of times behavioral issues will decrease because they're happy. And back to the quality of life that we were talking about before, they're happy and they're fulfilled. So they don't need that inappropriate behavior to gain what they want and what they need.
And back to the employment, what are employees saying to you guys about the people that do come through the door and work?
Well, often times if an employer has never dealt with somebody with a disability, either through their personal life or just their community involvements, there's a fear that their company may be put at risk, or you know, that they're taking on a risk. But a lot of times after they've hired somebody, like I said, they'll find that these are people that are excited to come to work. They're ready to do what's asked of them, and you know, we'll provide the support, whether it be through a job coach or just whatever, to help overcome those hurdles.
And this question for both of you: why is awareness so important for people who struggle with disabilities?
Well, like I said at the beginning, the old terminology of mental retardation, which is a term we no longer use because society stuck a negative stigma to it. So I think the awareness of, you know, someone with a disability has the same wants and desires and abilities, maybe with a little bit of help. We're each individuals, and we just need to focus on that individual and help them succeed in their life. Our mission statement is improving the lives of the people we serve, and so that's always what we're going to strive for. And intellectual disability, autism, those are going to be lifelong diagnoses, but with the right services and support, advocacy, support from the community, a person really can live their best quality of life.
Anything to add to that?
I would just say we also have crisis programs for individuals with developmental disabilities through central counties. And what I'm learning is by teaching our individuals with disabilities to advocate for themselves and also work with the community to build awareness, it's helping the community really embrace the individuals and know how to help them through the crisis or whatever is happening in their lives. I think individuals with disabilities, as she was saying, the stigma was very much they don't understand, they don't get it, they're not going to be able to ever do this, and that's not the case. And so I think awareness is really helping us bridge that gap between individuals with disability and the community, such as law enforcement, community partners.
What comes to mind? More hope, more recovery.
Just back to our mission statement, improving the lives of the people we serve. People with intellectual disabilities or autism don't need to be tucked away in institutions or in facilities with only people like them. More hope for community involvement, more community acceptance, more recovery, just to reach their full potential. And have the best quality of life.
You're not getting away. More hope, more recovery.
Well, for me, working with families with family members who have disabilities, it's hard and it's challenging and it's weighing on the family and it weighs on the person with the disability. Recovery to me is you might not recover from the disability, but the family can find healing. You know, the family can find progress. The person with the disability can find progress. And to me, that's the recovery, when I can go in a home and I can see the family unit is happy and functional, and the person with a disability is happy, and there's understanding. I think that's what recovery for us is, and that's what the hope is.
It's good when you like your job, and both of you seem like you do. What do you like about your job?
I love whenever we have an individual come in that maybe is having a lot of behavioral problems, having a lot of problems at home or at school, and the family just doesn't know what to do, and we're able to link them to services like behavior supports, have somebody coming out and taking them in the community or working on skills training, and just seeing that they can blossom and, you know, and make improvements. And like she said, it goes back to the whole family, everybody involved with them. That's an amazing thing to see.
Same question. Why you like your job?
I love my job. I love getting to know people. I love seeing people really. I help people change their behavior, but it's really up to them, and it's really their wants and needs, and it's really them learning about themselves. And when they can be successful in life and they don't need me anymore, that is the best feeling
That's awesome.
anyone can ever have.
Andrew, Kristen, thank you for what you guys do, and just thanks for getting up every day, going to work, and making a difference, because both of you are. Appreciate you guys.
Thank you.
And we'll be right back. Hello and welcome back to KPLE special program on Central County's Services, Health, and Awareness. In the studio with me now, we have Mr. James Arnold, who's the Assistant Director of Behavior Health, and Mr. Dr. Ray Helmkamp, Executive Director of Central County's Services. Hello, guys, and welcome in the studio.
Thank you. Thanks for having us.
First question is for you, Mr. Arnold. What is DSRIP or DSRIP?
Yeah, we call it DSRIP. Essentially, it's under the 1115 waiver programs. It's a delivery system reform to basically get our services up, better and better. So we're aiming to have a better quality of services. There's a little history behind it, especially for Central County Services. We started our programs back in around 2013, and it was very centered around projects. So we started quite a few projects. We integrated ourselves in Temple ISD. We integrated ourselves with a day hab facility for adult mental health. We had a couple IDD services, specifically for autism and Asperger's day hab services. We started a mental health deputy program and a chronic health concept. And it was a lot of different things. Over the last couple of years, things have changed. As of January, we got new protocols. We call it now DSRIP 2.0, which is very fitting with the tech age. But what we're doing now is it's not so much about projects. We have those projects. A lot of them are still around. But now we want to integrate them fully into our service array and essentially make sure that we're doing a better and better job each year.
All right. What is the focus of CCS in terms of DSRIP?
We are really focused on, like I said, the quality of services.
Okay.
So we want a lot of community collaboration. We want to ensure that our clients are getting the services they need. You and I are very different, and everybody else in the studio and everybody else watching this is very different than you and I. So we want to really reach out to that person specifically and meet their needs. That takes a lot of different types of services. We can't just do cookie cutter services for folks. We have to meet them. Earlier in the show, Cheryl mentioned our integrated care is kind of getting off the ground. We just hired a family practitioner nurse, and we want to make sure that we're meeting people's needs medically as well. The body is all one thing, the brain is part of it, and we can't be so narrow-minded that it's just mental health anymore.
So that holistic approach is pretty powerful.
Absolutely.
In what you guys are doing.
Absolutely. We want to look at people at their holistically, just like Cheryl had mentioned, mind, body, spirit, and
how do y'all work with other agencies in regards to the DSRIP program? I know you said TISD. How has that collaboration been?
TISD was very welcoming to our project. We've served a lot of individuals. I think there was over thousands and thousands of encounters each year.
Wow.
Providing services in the schools and Temple. We collaborate with many partners in the community. As was mentioned earlier, we cover 5 counties, so there's a lot of players that come into account. We're very involved with our county judges, our county jails, our county sheriff's offices. We have those jail diversion programming that's going on. We have the chronic health piece, so we even contract with the health department if we need some extra nursing models over there. And continually, we're always evaluating who can we involve to better serve our folks and serve our community in general. So we've had many conversations lately with Jim Hornsby over at CTLC in Temple, and the Feed My Sheep project, and we're looking at a model of kind of a crisis drop-in and seeing how we could fit with these integrated things that pull in a lot of different players, a lot with Scott and White and doctors and dentists and stuff, and hopefully that gets off the ground very soon.
Man, a lot of groups need to get over and follow you guys' model about how to really get in the community, because it seems like you're reaching out to so many people and getting services done. And this next question is the big one people always want to know. Outcomes. Tell us what has been the outcomes expected with the DSRIP program?
Absolutely. At the end of this, a big piece of DSRIP is that we're moving away from, Charles, you come in and I provide you service and I bill for it. And every time you come in, I bill for it. But we're moving towards, we don't bill for it, we don't get paid for it unless, Charles, you improve. So that's where we really want to make sure that we're tailoring our services to your needs. And overall outcomes, that includes, it's going to have to include other partners. You know, we have a very large crisis, response population in our area. We want to make sure that we're meeting those needs, and it requires bringing in other partners. It requires us having open communication with hospitals, EMSs, our local law enforcement, and getting people to where they need to be. We don't want to be incarcerating everybody that has a mental illness just because that's the easy thing to do. We want to go to the root problem where somebody's not just continually going to jail because they're having delusions or hallucinations.
Dr. Ray, we're not leaving you out.
I know you're not.
As the CEO, what do you hope to accomplish within the next 3 to 5 years?
That's a great question, Charles. As you can see from earlier with the talented staff at the center, they were going to help me lead the center to a variety of things. One, we want to be certified as a certified community behavioral health center, which really expands our services beyond just the state performance contract into the areas of those individuals with substance use disorders, veteran services. We want to instill the cultural change of trauma-informed care, of integrated care like Dr. Paulus, where we have our individuals are being seen by a family nurse practitioner that James mentioned, Dr. Paulus has said. We want to get our staff infrastructure in place where we can respond to the myriad of information that comes to us on a daily basis. How much of that information has relevance to the center? And to sift through that information and make it relevant to us so we can act on it. Just two final things. One is we need to get our data management infrastructure in place to better respond to data-driven decision-making. Typically, nonprofit organizations don't have the infrastructure in place, but we want to know exactly where we are in terms of revenues, billing, expenses, and just-in-time daily basis. And finally, we want to continue our entrenchment in the community. You mentioned community. It's a big thing for me, and my staff have responded quite well. We're the tip of the spear, basically, in problem solving, in solution orientation, task analysis. We want to continue that.
So, and speaking of the community and the impact, in your time there, what has been the greatest impact you feel?
Yeah, I think the greatest impact is us reaching out to the network of social service providers. We, after all, are the designated local mental health authority and the designated local intellectual disability authority for the 5-county area. We have a duty to meet with people, to collaborate with people, to problem solve with people, to resolve issues in the community, and deal with community issues in large that impact us and impact other centers. So that's our greatest impact, I think.
I've heard you say problem solve and communities, and you can't go through all of that without some challenges. What are some challenges you face?
Well, our greatest strength in community collaboration is actually one of our greatest challenges, and that is community collaboration.
Wow.
These individuals,
Yeah.
social agencies have their own staff, have their own budgets, have their own goals, and to get them around a table and to instill a common cause, a goal orientation to them, move us all in the same direction, it is a challenge. Yeah, so.
What, how do you know if Central Counties is successful?
It's successful. It's one, when I was division director of IDD years ago, Ms. Erskine has that now, I asked the same question. How do we know? Someone walks up to you in HEB and they find out where you work and they ask you this question, how do you know you're successful? You know, how do we answer it? So I answer it by this, an effective, seamless, quality service delivery system in which our consumers are happy, their needs are being met, there's effective customer service behind it, there's timely delivery of services. Obviously, we meet the performance contract that either by the federal government or the state government. Another way we're successful is that we impact community change. You know, the community is a living, breathing organization, and by such we need to impact change within the community that will positively impact ourselves, and it will, by nature, impact other organizations as well. Another way I want to know we're successful is that if there's a meeting of key stakeholders, Charles, and we're not present at the table, I really don't want them to have a meeting. I said, Central Counties is not here. We need to wait for Central Counties, or we need to hold up the meeting until Central Counties here, because we're that important in making
That's awesome.
change. Yes, sir.
One of the things, and I know you guys like me watch TV, you listen to the radio, or you read the newspaper. One of the things that's happening, and I think it's great we're talking about Central Counties, because you guys can play a really huge part in this, what I'm getting ready to talk about. You can't turn on the TV, the news, social media without seeing all of these school shootings. And what are some of the signs that parents should be looking for if the kids isolate, or kids are doing things that mothers know in their heart or dads know in their heart that, man, there's something different about my kids. What advice would you give them?
Yeah, well, stay connected with your kid as much as possible. Stay connected with the child. Talk to the child, learn what they're doing, recognize that if they're backing away from you and seeking that isolation, assess how they're communicating. Are they drawing figures of death rattling scenarios on paper and passing it around? Do they have any friends? I always question. It's okay for parents to say, "Hey, you know, who are your friends? Let's talk about it. Have friends over, so forth." Be aware of what they're doing. If they're hoarding things, this kind of stuff. Just the key is to connect with your child. And sometimes for parents that's painful. If the child is exhibiting inappropriate behavior, to connect with that child, it's tough to do. It takes strength of a parent to connect with that child. But I think that's the best thing I would do. James, anything? Yeah.
Well, I want to echo, being connected with your child. I think it's very important that these connections, especially in the digital age, we made a joke earlier, but it is true. The parents and the children both down at the phone, spending time with your child, and then, moving on, that open conversation, having a conversation not only with your child if it's needed, or reaching out to somebody that is a professional and just kind of bouncing it off of them, asking questions, being knowledgeable.
I think both of you said something key. I think another thing we can add to that is, as parents, we need to be intentional about doing it.
Sure.
Because we can, you see it, you go to a restaurant and you see everybody in the family on a cell phone, and you're like, really? People don't communicate no more. And I think we're getting less and less with that. What are,
if I may add one thing to that. There's an old saying that if it doesn't feel right, it isn't right.
That's right.
A parent should take that to heart. If it doesn't feel right, it isn't right. So it's okay to talk to a school counselor, and it's okay to take it above the school counselor to maybe the police and so forth if there's alarm bells going off.
What about fear? Because I know there's a lot of fear out there right now. Do I need to take my kids out of school, put them in homeschool or private school? Can y'all touch on that any?
Yeah, I think that, honestly, I think the anxiety has been raised in this country dramatically with the school shootings. people are not necessarily looking over their shoulders with paranoia, but there is an element of anxiety, lived, breathing reality of anxiety every day in people's lives. Now, if that transfers to fear, you know, that's probably another step up. But no, society has changed. Our society has changed. When I was growing up, and I'd leave in the morning at 7:30 barefoot, and I wouldn't come home till 5:30, and I'd say hi to my dad and mom, and things have changed. You don't let your kid walk around the block. You don't let, you know, and so, yes, how that anxiety impacts the family, impacts the individual, impacts the workplace, and that's what we have to work on.
Wow. Any thoughts on that?
Yeah, I'll add. You know, just my personal experience having a 12-year-old. You know, a lot of things have come up that I never dreamed that would be a topic of conversation at my dinner table. And, you know, every moment, in my opinion, is an opportunity for learning and guiding my child. And I go on record saying, you know, when I was this age, my biggest worry was making sure we had enough people to play basketball when we got home. And, you know, the numbers they're not lying to us. You know, the feeling of hopelessness, the number of friends, the number of interactions they're having a week are going down. The numbers of suicide for 10 to 14, I was just reading 2 days ago, it was up 200% from before 2011. And so we have to integrate our life with our children's and collaborate with them and work with them at any given time, all the time.
Well, James and Dr. Ray, our time is up, but I just want to take this time to say thank you all for what you do.
Charles, thank you.
Thank you all for being on the show, and we appreciate y'all. And great way to not just talk about being in the community, but really getting in the community and getting involved. Thank you, guys.
Thank you, Charles.
Yes, and thank you.